then. Good morning. You may notice we have a new student in the class, Dr. Ellerby. We should have Dr. Ib joining us shortly. They were kind enough to respond to my request to evaluate my teaching ability. So, as promised, we would pick up. We ran out of time last time when we were talking about the Affordable Care Act, so I'd like to pick up there where we left off. So, Ms. El Rawi over here, can you tell us what is a medical home? I do have the right person, right?
Yeah.
Okay.
So, I should be here, but yeah. When we get service at home, like.
I'm sorry?
When we get service at home, like nursing.
Miss Amade over here, can you help her? What is a medical home under the Affordable Care Act? You're there, right? You are Miss Amade? Yeah. I'm sorry? This was on the last block. Miss Antonia, I saw you come in. What is the medical home?
I understand medical home to be similar to that of a skilled nursing facility where you have a location
A
where.
location.
Yeah,
When is the last time you talked to a location?
not a location. I think.
When's the last time a location has rendered an opinion or had a thought? Ms. Baker over here, help him out. What's a medical home?
I'm actually looking for my notes from that.
I'm sorry?
I'm looking for my notes from that lecture.
It was from the reading.
I like the notes on there.
Ms. Choi,
It's like a collaborative, like a group of people that take care of it.
is that what it says? You're closer. I saw another hand. I'm sorry? There you go. Okay. A building cannot coordinate care. Right? A building cannot make decisions. I saw another hand over here. Let's see, 1, 2, 3, 4, 5, fifth row. 1, 2, 5. And Ms. Yang Chen? You look different. Anyway, so who may be designated as a medical home?
So medical home pretty much refers to the idea of having like coordinated care led by a physician usually, but it can be more.
Okay, so a physician may be a medical home. Anybody else? Pharmacist may be a medical home. In the act, it says a physician, a nurse, or any health professional. When the Affordable Care Act was being drafted, that was an issue. There were those factions that said, well, we should include pharmacists. And other people said, well, we should include optometrists and dentists. And then we started thinking about it. And once you start enumerating all these professions, it becomes an exclusive list as opposed to what it is now, which is inclusive. It says physician, nurse, or any health care professional. And I don't think there's any question that a pharmacist would be recognized as a healthcare professional. So at that point, we figured out that it was probably better to leave it be, because otherwise it would never get passed. Okay, it almost didn't get passed. Okay, so now that we've established what a medical home is, Mr. Bhatia over here in section 2, could you distinguish the differences in reimbursement between your typical fee-for-service, I think that Dr. DeSalle probably described in class, versus an accountable care organization, ACO?
So fee for service, you would get the service first, and then you would get get reimbursed after. Whereas in
ACO?
ACO you select from available list of services.
No. Caitlin Dang, can you help him out? How's the reimbursement scheme for an accountable care organization?
The fee for service, you pay for the service that you receive.
Okay. So what's the incentive there? If you want to maximize, okay, everybody's altruistic. You know, you want to do things for good, but bottom line is you want to get paid, right? And in a capitalistic system, you want to maximize the amount you get paid. So in a fee for service, how do you get rewarded? How do you maximize your pay? Okay, you can. Let's see, who is that? Mr. Kabadi, is that? Okay, you can see a lot of patients, or you can see the same patient multiple times, or you can order a lot of things that may not be necessary, right? Do you think that maybe contributes to our escalating healthcare costs? Okay. So, Ms. B, Ron B over here. How is the accountable care organization different from that?
Accountable care, it's what paid before gets paid.
I'm sorry?
We pay before patient gets paid. Compared to ACO, is patient paid for,
Can you hear over here? They can't hear you.
ACO is,
As they say in Japanese, Maraoki kudasai, loudly. Holler at that person over there in the corner.
ACO is, the physicians get paid after patients are sick and visit them. Compared to, accountable care act is,
No, not accountable care organization.
accountable care organization is, patient paid for fee for service when they get sick and visit the physician.
Not quite. Ms. Tran, right?
I believe ACO is being paid a fixed rate, so it doesn't matter how many services you do, there's a fixed rate.
Fixed rate. So each time you see a provider, you get paid?
No, the providers get paid. Just give services to,
So how do they get paid?
they have a certain amount of people come and see the provider, and providers give us service.
Okay. Oh, you already wiped everybody else out on the block exam. You got no points. Actually, an accountable care organization, and I haven't been able to figure out the difference between an accountable care organization and a health maintenance organization. Okay. I look at the characteristics, and they're very similar, if not identical. I'm still trying to figure it out. So basically, for fee for service, you charge the patient for each encounter. Okay. The more encounters, or the more complicated the encounters, the more money you get, right? Which gets more expensive for the patient, right? Which also gets more expensive for the insurer, and so on and so forth. Okay. Now, health maintenance organization and accountable care organization. What do you start with? You start with a bucket of money. Okay. It's the best way I could describe it. You start out with a bucket of money. And for a defined set of people, for a defined population, you say you have this much money to take care of this many people for for the next year, 12-month period of time, all right? So, what's the incentives here? Let's look at the HMO. What's the incentive? When I talked about, that's why when I was talking about the Affordable Care Act last time, I talked about the history of Kaiser Permanente and Dr. Sidney Garfield, okay, who was out there in Grand Coulee Dam during the construction. There were all these people getting injured. So what did he do? He took a look around the yard, talked to some of the foremen, and said, maybe we can prevent these injuries. Prevention! What a concept! What a concept. If you keep people from getting sick, then they won't have the more expensive encounters later on, right? What's more expensive? A flu shot? Or 4 days stay in the hospital with pneumonia? He says, oh, but only 1% of the people would get hospitalized. 1%. Okay, well, you multiply the cost of the vaccine times 100. Does that even come close to 4 days of hospitalization? No. So, basically, the Accountable Care Organization is not segmented, all right? It's not just a hospital. It's not just a clinic. It's everything put together. One package, okay? And they have somebody in there that manages the care, right? Coordinates the care. In most cases, it's a physician, but the Affordable Care Act envisioned those people that would not have health care readily accessible. Okay. Anyone ever been to Medford, Oregon? You don't know where Medford, Oregon is? It's like California Annex, okay? It's like 10, 15 miles over the California border, okay? You ever been up Northern California by the Oregon border? I know there's nothing up there. A lot of nothing. For the longest, I don't know if things have changed, but Alpine County, for the longest time, and it may still be, is the only county in the state of California that had no pharmacy. So anybody that's an entrepreneur that wants to open their own pharmacy, Alpine County. Okay. So that's the, I can't say it's a distinguishing characteristic because it's very similar to an HMO, but that's the way that the Accountable Care Organization works. Plus, according to the Affordable Care Act, there are incentives for performance improvement. Okay, if you do something that's innovative and your patients are healthier than the rest of the country, you get a bonus from the government. You get a bonus for not spending your own money. So not only do you save money, but you get a lump sum from the government for not spending your money. What a concept. Any questions? Yes. Can you hear her? No. They can't hear you.
Don't you have to apply for a waiver to apply to do something innovative? Because isn't it about equal care for all patients?
Don't you have to?
Because isn't it that under the Accountable Care Act, all providers have to provide equal care for all patients?
Right.
But if you're trying to do something really innovative in a certain area.
But then you're providing that same service for all patients, right?
Oh, okay.
You're thinking of microcosm. You're thinking of one patient at a time. I'm thinking populations. Sorry, that's my bias. My background is as a hospital administrator. So I don't think of one patient at a time. I think about, a group of patients. Any other questions about Affordable Care Act before we move on to Business and Professions Code? Yes.
So for the ACO, the way that they get paid, is it the same as capitation?
No. Capitation is a limit. Okay. Here, you're not charging anybody. You already got paid, right? So you spend as what you feel is appropriate. Doesn't matter what you spend. You're not getting any more money, right? Capitation refers to when you submit claims. You're not submitting claims to anybody. You already got paid. Does that make sense? You have to switch the way you think. You get paid up front. Okay. It hasn't worked so well for the legal profession. They have prepaid law. Didn't quite take off like Kaiser. Okay. Let's go ahead and start with Business and Professions Code. All right. Who are we going to talk to? We're going to talk to Mr. Chiam over here. Okay. Smart guy, right? You're in pharmacy school. You already finished your first block exam. What's a prescription?
It's an order for treatment.
An order for treatment. Okay. So, is an X-ray a treatment?
No.
No. Would it can someone write an order prescription for an X-ray? Okay. You're close. How about Mr. Dang over here? Section 2. What's a prescription?
It could be any form of written or oral or electronic or medication.
You're getting too detailed. I'm looking for one word. Medication. So an X-ray is a medication? Megan Handel over here. What's a prescription? No, that's what RX is. You have a prescription for tater tots? Well, hang over here. What's a prescription? One word.
An order.
An order! You guys already, what are we, eight weeks into pharmacy school? And you're just now learning what a prescription is. Okay. That's all it is an order. And what she said over here is a recipe. And a prescription is not a recipe, but the RX that you see, that comes from the word recipe. That's back from the days when there were no commercially manufactured pills. Everything was compounded, mixed together. Gather together some leaves, some berries, some roots, mix it all up, boil it up, plug your nose and swallow it. Okay. Nasty stuff. That's something we should do. We should offer a course in pharmacognosy. I don't think that many people take that anymore. Okay. So, Ms. Kim over here, Hee-Ju Kim. Who may prescribe? I'm sorry? Can you hear what she's saying? They can't hear you. A physician may prescribe. Okay. Mr. Cuck, who else may prescribe?
Medical doctors,
She just said that.
physicians, podiatrists.
Podiatrist, okay, that's another one. Juan Lee, who else may prescribe? Dentist. Christine Lowe over here. Who else may prescribe?
Veterinarians.
What?
Veterinarians.
Veterinarian. Okay. Ms. Montoya. Who else may prescribe? Optometrist. Yes, interesting. Are there any restrictions about what an optometrist may prescribe?
They can only prescribe like medications that are to do with treatments of the eyes.
Okay, for a little bit louder and repeat that.
They can only treat for,
Treat?
well, they can only prescribe for treatment of the eyes, like eye infection.
Close. Close. For diagnostics and treatment of diseases of the eye. Okay. Now, what if a patient had pain in the eye? Could an optometrist prescribe a narcotic? Not necessarily to be instilled into the eye, but taken by mouth so that it goes to all parts of the body. May an optometrist do that? Ms. Wynn, Eileen Wynn.
Yes, because as long as it treats the area of the eye.
Okay, are there any restrictions? Diana Wynn over here. Any restrictions for a narcotic written by an optometrist? No, that's not prescribing. It's in that supplemental reading that I gave you because they don't have it in the pharmacy law book. Julia Wynn over here. What are the restrictions for an optometrist to be prescribing a narcotic?
They have to be registered with the DEA.
Well, yeah, we'll get into that next semester. But as far as what you read for today's class, what's the requirement? What are the restrictions? The duration of treatment cannot exceed 3 days. It says that in the Business and Professions Code. Now, Marilyn Wynn, I'm going through all the wins. Marilyn Wynn over here. Are there any such restrictions on any other prescriber? What are they? You believe that? You believe in Santa Claus? I'm sorry? Can you hear what she's saying? They're shaking their head no. They can't hear you.
So possible restrictions may be due to the fact that they can either treat or diagnose or cure diseases that are pertaining to their field.
Where did you read that? I'm sorry?
I have it in my notes.
You have it in your notes. Do you know where you found it? Because that would be news to me. By law, there is no restriction on any other prescriber other than optometrists. All it says is in the Business and Professions Code is that they have prescriptive authority. They may prescribe. Now, it may be unethical, but according to law, their prescriptive authority is not circumscribed. If a dentist writes a prescription to treat arthritis, there's nothing in the law that prohibits it. If he has no idea about how to treat arthritis, it would be unethical for that person to do that. but it's not illegal. Okay? You'll find that in the course of studying law, you'll find that there are a lot of things like this that, even though it's permitted, is generally frowned upon. Okay? Or I should say, even though it's legal, is frowned upon. Okay.
Dr. Yoshi?
Yes.
So if it's unethical, is that grounds for a legal case against the prescriber, even is it illegal?
What would be the charge?
Proper use of the prescribing powers and
We'll get into that next year when we talk about liability. You haven't been taught yet what the basis for negligence would be. So just because someone deviates from a particular standard doesn't necessarily mean that there's an injury. There would have to be an accompanying injury, and that injury had to be directly related to the breach in the standard. Okay. We'll get into that in the spring, in the fall of your P2 year. Hold your horses. You need a little bit more foundation until we get there. Okay. Ms. How do you pronounce Nissan or Nissan? How do you pronounce that? Nissan. Okay, like the car. Okay, no relation. Okay, otherwise you probably wouldn't have to be here. Okay, so may a nurse practitioner prescribe?
Prescribe on her own?
Well, isn't that the definition of prescribe?
Well, she can under, if the physician is under her, like, above her, telling her to write it.
Say again now.
Like if, the physician told her to write it, like a PA, you know, I think on her own now, then she can.
Okay, so what does prescribe mean?
Prescribe like order treatment.
Okay, that you come up with on your own, right? Okay. Mr. Oreke, how about, she mentioned nurse practitioner. May a nurse practitioner prescribe? Or physician assistant, rather. No. But did they write prescriptions?
Pretty sure, yeah.
Pretty sure. So what is that doing? Mr. Lott?
yes, they furnish.
They furnish. Okay. You just say me that now I don't have to call on you next class. Okay. So what's the difference between furnishing and prescribing?
So when you prescribe, you have the authority to do so, but in furnishing, you're under protocol.
You're restricted to only doing what's been approved under the protocol. Now, does it specify how specific the protocol needs to be?
So repeat that?
Is there anything that requires the protocol to be specific?
Yes,
No, where is that?
I'm not sure.
It doesn't exist. The law is silent in that area. It may be as narrow or as broad as the supervising physician feels comfortable with. Now, initially, it's probably going to be very circumscribed. It's probably going to be very narrow. But just like everything else, and this is one of those things, this is what Track 3 is all about, is that not hard science, but relationships, okay? As the prescriber feels more comfortable with the person that he's working with, they're more likely to broaden the scope of the protocol. I've seen one instance where the protocol was that the delegation was for any FDA-approved drug so long as it was so indicated by the FDA. That's pretty broad. any drug approved by the FDA. Okay. Mr. Cook.
So with the oral contraceptives and the pharmacist allowing to furnish or prescribe,
Furnish.
it's just furnished?
Furnish because it's pursuant to a protocol that has been established by the California Medical Board and the California Board of Pharmacy.
Okay, so that means that the prescription is coming from the board?
Pharmacists.
Okay, cool. So that means pharmacists can write a prescription then?
Pharmacists can write a prescription. That's what I'm leading up to. Okay. So, Ms. Rasuelo. So we have established that physician assistants and nurse practitioners, and as Mr. Cook said, and pharmacists may furnish. There are any other entities? I do have, as your, that I, certified nurse midwife. Okay. Anybody else? One more category. Ms. Dow. Naturopathic doctor. Very good. So let's see. Mr. Singh over here. So, may a clinical psychologist prescribe in the state of California? No. It's not authorized by law. Although it has been authorized in other states. Now, in the spring, we're going to take a trip up to the Capitol. I told you about that. Okay. And undoubtedly, there's going to be a bill before the legislature to authorize clinical psychologists to prescribe, drugs in the area of their specialty. How do I know that? Because they do it every year, and every year it fails. But they ask anyway, figuring one of these years they're going to get lucky. Okay. Ms. Roque over here. May a receptionist in a doctor's office prescribe? No. But don't they sometimes call prescriptions into the pharmacy?
They do, but they're just verbalizing it from the doctor's order.
Oh.
The one prescribing it.
Is that permitted under law?
Yeah.
And what's it called?
I'm not sure.
Let's see. Ms. Sampley, what is that called?
I know they're acting as an agent.
Agent. Very good. It's called agency. Okay. An agent is, it's not like those action movies where, people are shooting at each other. That's a different kind of agent. An agent is someone that acts on behest of another. Okay? There are some people that say the agent has to be an employee of the prescriber. If that was the case, that would mean that a nurse in a hospital couldn't call in a prescription for one of the physicians there. Because the nurse is an employee of the hospital, not of the physician. Right? Is there any requirement for qualifications for this agent? No. Because they're not making any decisions. You can teach a parrot to talk. If you go to New York, they'll tell you that somebody taught their dog to talk. What's on top of the house? Roof. Who's the greatest baseball player? Roof. Ah, go away. And the dog says, who, Joe DiMaggio? So, let's say, let's say a physician is out having dinner and he has fish, and the fish wasn't prepared very well. And he has to run to the restroom. Okay. And as he's on his way to the restroom, he gets a text message from the exchange saying that there's somebody at the pharmacy that needs a refill, emergency refill. So on his way to the restroom, he stops one of the waiters and tells the waiter to call a CVS pharmacy on MacArthur and Broadway and tell him it's okay to refill Mrs. Jones' prescription. Okay. Waiter doesn't know what is it. He looks it up, calls. He says, "A doctor just said it's okay to refill Mrs. Jones' prescription." Is that legal? Yes, because the waiter is functioning as an agent of the prescriber. Normally, you wouldn't expect a waiter to be doing this. But how else would that waiter know that Mrs. Jones is waiting at the CVS pharmacy on MacArthur and Broadway waiting for a prescription if it wasn't for the message that was received by the prescriber, right? Okay. Yes. At this point, no, because there's no disclosure about the health condition, only that somebody's there with a prescription, right? There's no indication as what the prescription might be for. It's like the business exception when you announce on the overhead, "Mrs. Jones, please return to the pharmacy." Course of business, normal business operations. As opposed to, "Mrs. Jones, please return to the pharmacy. Your chlamydia meds are ready." Not so good, Mr. Cudd.
If you send in an agent to send or approve of a refill, don't you have to provide patient information to confirm who it is? Just because the pharmacy did send it in, is that grounds for, oh yeah, we know who it is?
How many Mrs. Jones would be waiting at the pharmacy counter?
Well,
Now, if it was Miss Wynn and it was Westminster, might be a different story, right?
right.
Okay. Okay, so enough about prescribing. Let's get into the nitty-gritty about a pharmacy. So, Ms. Samra over here, are you familiar with San Diego? Yeah. You been to San Diego? You ever been to Old Town? No? Never been to Old Town? Try Fred's Mexican food. Best seafood enchiladas. Anyway, as you're entering Old Town in San Diego, okay, you pass on the road up there. There's a little shop on the right-hand side called the Apothecary. Okay, and they sell glass jars. They sell perfumes. They sell cosmetics. Is there any violation of law there? No? Okay. Ms. Srudam? Is that how you say it? Yeah. Okay. Is there any violation of law with this place that says apothecary and they sell perfumes? No. Isn't there something in the law that says that no establishment shall advertise pharmacy or drugs or apothecary or RX unless it's a licensed pharmacy. You remember reading that? Yeah, you just forgot. Okay. So let's talk about that. So who licenses the pharmacies? Ms. Tuma, who licenses the pharmacies? California Board of Pharmacy. And what is their stated top priority? What is the role of the Board of Pharmacy? Primary role. I talked about it before. To protect the public. To protect the public, okay? Sometimes it means protecting the public from the prescriber, okay? You might have to help me on this one. Ms. Woldesmayat? How do you pronounce that? Oh, I'm sorry, over here. No? Let's see. 1, 2, 3, 4. 1, 2, 3. 1, 2, 3. You're not Ms. Hiwat Woldesmayat? No? Not prepared. Okay. Let's see. Teresa Wu. Where? Okay, there you are. So, upon the initial dispensing of a prescription, other than getting the HIPAA information, once the prescription is filled, what are the requirements by the pharmacist? Loudly. I don't think they can hear you over here.
So is it before the prescription's given to the patient? Is that
That will be good.
it's required that the patient obtain consultation from the pharmacist?
Okay. Have you ever worked in a pharmacy? Okay. So after prescription's filled, the clerk is collecting the money and it says, "Would you like to speak to the pharmacist?" And the patient says, "No, that's okay." Does that meet the requirement? No. What should happen? Ms. Errol, I'm sorry. You're sitting in a different chair.
Yeah, I should be here. I'm sorry.
We have drugs for that. But you don't get the lecture on schizophrenia until P2 year, right? Okay. Ms. El Rawi, okay. Go ahead.
So the pharmacist, he has to talk to the patient and tell them that he needs to get that consultation, because if they're not gonna get that consultation, they will never know about the side effects of this medication, and maybe that will lead to death, or maybe
And if they die, then they'll never pick up their refills, right?
yeah. If
Yeah.
no, this is if it's a new prescription.
It's a new prescription. Okay. So the way that the clerk should verbalize this, and this is for your practice, okay? For when you were out in practice. The clerk should tell the patient, the pharmacist would like to speak to you. Okay. And if the patient says, the patient has a right to waive the consultation, okay? However, the ultimate arbiter, the ultimate person that decides whether or not she can have the prescription without the consultation is the pharmacist, not the patient. Okay. So if the patient says, oh, I've taken this before, I don't need consultation, what the clerk should then do is turn to the pharmacist and show the pharmacist the drug. Says, this patient wants to waive consultation. Can they go? And the pharmacist has to say yes or no. Okay. The patient can't decide on their own because the pharmacist is the one that's ultimately responsible. Now, the requirement for the consultation is that for any new prescription, okay, are there any other times when consultation would be required? And let's have Ms. Young over here, Denise Young. When would consultation be required? Okay, if the patient requests it, okay. Anything else? Any other time? Mr. Calloway.
If it's their first time receiving it.
First time receiving a prescription, okay. Any other time? Ms. Tuma.
There are major side effects that they may experience upon taking medication.
Where is that stated in the code? If there is any change in the prescription, okay, if there's any change, it's required that the pharmacist consult with the patient to let them know about the change. What if the patient has been getting a fairly common maintenance med and they're getting it every time, okay? They're getting it every month. And what if the pharmacy switched from brand X generic to brand Y generic? Is it necessary to inform the patient? Is it necessary for consultation? I see a lot of heads nodding, and the answer is yes, even though it doesn't happen. A lot of pharmacists are violating the law. Okay? It is required for any change, including a change in generic from one generic to the other. Now, how about if is it ever required, if there's no change in the prescription, that the patient should be consulted on a refill? Mr. Urbano.
Could you repeat the question again?
Would it ever be required for that a patient receive consultation if nothing has changed and it's a refill?
I don't think so.
You have a good lawyer? Okay. You have to understand, okay, prescription drugs. Why do they require prescription? Because they're dangerous. The FDA doesn't feel that they're safe for a patient to self-treat. Okay. As you progress in your pharmacy education, you will learn in I think it's Dr. Ip's class. You guys teach about narrow therapeutic index, or is that track 2?
A little bit in
Both, okay. You'll hear the term narrow therapeutic index, okay? What that means is that the dose required to medically treat the patient is not that much different than that dose that will cause a toxic effect, okay? So for drugs with a narrow therapeutic index, My second favorite drug in the world after camphorated tincture of opium is warfarin. I like warfarin. Warfarin has a narrow therapeutic index. Warfarin, well, anybody ever live in an apartment that had mice or rats? I grew up near the San Francisco waterfront. We always had rats. We always had mice. And the number one selling rat poison contains warfarin. Decon. You ever hear of Decon? Decon rat poison? It has warfarin. It's a blood thinner. Okay. So, what I'm getting at is that because of this narrow therapeutic index, on a refill, particularly on the first refill, okay, the first refill for a drug with a narrow therapeutic index, be it warfarin, be it digoxin, any of these types of drugs, it doesn't have to be as detailed as the initial consult, but I would speak to the patient and ask them if they are experiencing any of the side effects. Okay. So in the case of warfarin, that causes bleeding. Okay. I just want to check with you. Have you noticed any of the following changes? Have you noticed you're more prone to bruising? Or if you get cut, does it take? Are you noticing it takes a lot longer to stop bleeding? Are your stools, do they look darker? Okay. All these are signs that maybe the dose of the warfarin is too high. Okay. And this is, why is it? That's because the initial dose, the patient is being titrated. Okay. Patients, they're adjusting the dose, especially that first month. And warfarin is one of those that it doesn't act right away. It takes a couple days to have its effect. So after they've been taking it for a month, you're still in the process of titrating, still monitoring. Okay. And if the patient has any of these symptoms, you probably want to call the prescriber and say, this patient says that they've been bruising more easily. Maybe you should adjust the dose, something like that. That's where you would be expected to give a consultation on a refill, even though there are no changes. And where is it covered in the law? In the law, it says that the pharmacist shall consult with the patient when their professional judgment dictates. Okay? For those of you that don't know, I do expert witness work on the side. And this is one of the things that I testify about. A reasonably prudent pharmacist would inquire, particularly upon the first refill, for a drug with a narrow therapeutic index. Okay. Why don't you take 10 minutes and come back at 5 minutes after. Sure.
About the agent relationship, how the reader is able to tell the pharmacist to go ahead and do it. But that's only an emergency, right? Because I work in a pharmacy, and whenever we get prescription refills, we ask who the person is, where they're calling from, and their phone number. But in this case, the waiter, if the physician's in the bathroom, the waiter cannot come over and any of that information.
Well, you can take them to the way they can call it exchange back, or you can say, can you have him call me back when he gets out of the restroom?
Okay. So that's only exception in an emergency situation.
Well, I would say it's an exception.
Okay.
As it's all part of the process of verification. But you know, the person is going to abuse their nitrogen reserve. They have chest
I
pain.
just remember when I was little, about 14, 15, someone had me call the doctor and I didn't know what I was doing, obviously. So just to say that they refills on the diabetic medication. And I did. And I didn't know what I was doing. Now that I learned that I'm actually calling in a refill, which is amazing, you know? But, like, what if it's someone like that? I decided to call for my dad because I'm a refill, I don't want to talk to the doctor, right? And who's going to really do a background check on a diabetic medication if it's not a controlled process? So, yeah.
Huh?
How is capitation different from ACO? I mean, are they not capped out?
Well,
Don't they have a set like amount of money that are getting paid every month for a set population?
okay, but capitation is you can only charge so much.
Is that the definition of capitation?
Yeah.
I think we were told something else. I think. That's what I was told.
Yeah, you can only charge so much for and then after that you don't get any more.
So what's it called when they have like a set amount of money that they're being paid per month to see a certain amount of people?
Health maintenance.
Health maintenance.
Yeah.
Thank you.
Okay, it looks like it's about 5 after. Let's reconvene. Okay. How about we start off the second hour talking about prescriptions? That's relevant, right? You're going to be working in a pharmacy. So Let me go back. So many people didn't call on. Mr. Adams over here. So we established a little bit in the last hour that prescriptions may be telephoned in. When a prescription is telephoned in, what are the requirements? Mr. Adams? I'm sorry? You don't need that for any other prescription? What's required? Yeah, what's different about prescription that's being called in, telephoned in? So how do you fix that? I'm sorry? Okay. Okay. Is that it? How about Ms. Ow over here? Requirement for a prescription that's being telephoned in. How do you do that? We must reduce it to writing. You have to reduce it to writing. How long? How long do you have? I'm sorry, I didn't hear. You have 1 year to write it down? I can't remember what I had for breakfast yesterday. You going to remember prescription a year from now? Immediately. Must be reduced to writing immediately. Okay. Where's the next person? Did you pronounce it Bay or? Bay. Okay. So, if you're familiar with generic drugs, you talked about generic drugs in Dr. DeSalle's class, right? Expedited approval by the FDA. I'm sorry? I didn't get to the question yet. You know what a generic drug is, right? Okay. So, is it permissible in the state of California for pharmacists to substitute a generic drug for when a brand name has been prescribed? You need to talk to who?
The physician, if you can.
Where does it say that? You looking it up?
No, I'm just thinking.
You thinking, why did he call on me? Let's see. Who's that in the back? Is that Mr. Bada?
Yeah. They can give up generic as long as it doesn't say like dispense as written.
Okay. Is there any requirement of notification? Do you have to notify anybody that you're substituting a generic equivalent? Which one? Or both? You have to notify the patient. In the state of California, there is no requirement to notify a prescriber. Okay. The pharmacist is free to dispense the generic equivalent unless the prescriber has indicated otherwise by writing down the initials DNS, like for do not substitute. Now, what if there's a box and it says substitution, generic substitution is permitted unless this box is checked, and the box is checked? can you still dispense the generic? Mr. Asadoli? Okay.
You can still dispense generic if they check the box and initial.
Very good. In the state of California, even if the box is checked, you may still dispense the generic unless that box is initialed with the prescriber's initials. Dr. Ip will appreciate that because it was Kaiser that insisted that that box be initialed. Okay, because what we would have is patients get a prescription from the doctor and they didn't want the generic, so the patient would check the box. And we wouldn't know whether it's the patient or the prescriber. But most of the Kaiser doctors are trained pretty good that, we wouldn't buy the generic equivalent unless it was a good product. So this is one of those areas where, we were able to influence the legislation because it's too easy to check the box. So in order for that box to be effective, do not substitute, if it's just a matter of checking off a box, that box has to be initialed. Okay. Yes.
So if it's initial and it's checked off.
I'm sorry, I can.
Oh, sorry. So if the box is initial and checked off, but the patient prefers the generic, do you have to call the doctor as well?
Yes, if the box is checked or the doctor has specified do not substitute and the patient requests generic, you have to check with the prescriber because the prescriber has specified he wants a particular brand. And there may be a reason for that. Okay. For example, the drug Dilantin, phenytoin for seizures. Okay. The way that the Parke-Davis formulation is made, it is not as bioavailable. Okay. It takes longer for that drug to get into the body. Okay. So they have other generic equivalents, or it's not actually generic equivalent. It's phenytoin, 100 milligram capsules. But when you run the bioavailability in the body, it peaks too soon. You don't have that extended period of activity to control the seizures. And only that brand name is effective like that. Okay. So there could be a medical reason that the prescriber doesn't want the generic. For oncology, sometimes some patients would have trypanophobia, fear of needles. Okay. And they didn't want to get. They wanted to have as few injections as possible. And what we used to do is we used to give an injection of Ativan as a pre-med. But for those people that didn't want the injection, we would give Ativan as a pre-med to reduce the amount of nausea, but they didn't want the injection. So we gave them Ativan. It's a tranquilizer that has the effect of minimizing the amount of emesis. So the patient would be so nauseous. But they didn't take it orally. They didn't swallow the pill. They would put it underneath their tongue and dissolve it so it bypasses the first pass through the liver. Okay. Trouble is, you can only use the brand name Ativan because the generic tablets wouldn't dissolve under the tongue. So sometimes there are clinical reasons not to dispense. So if you have specific orders, do not substitute, and the patient wants the generic, you better check with the prescriber, see what the medical reason is for them not wanting the generic product. Let's see. Mr. Berhano over here, can you enlighten the class as to what needs to be on the prescription label?
The DEA number, the registration number.
Oh, that's something you don't want on the prescription label.
Label. How the patient needs to take it.
Directions for use. Is that all?
Their
Who?
the patient's name,
Patient's name. That would be helpful.
number of pills or quantity of.
The quantity. Name of the drug would be helpful, right?
Yeah.
Anything else?
Expiration date.
Expiration date. Is that it? How about the name of the pharmacy? And the phone number of the pharmacy and the address?
All that.
Okay. How about the name of the prescriber? Is that yes or no?
No.
Yes. You have to, whoever wrote the prescription, they have to put their name on it. Okay. Doesn't matter if it's the prescriber or the furniture, whoever it was that wrote the prescription. Okay. When would you find the dispensing pharmacist's name on the prescription label? I'm sorry? When would you find the dispensing pharmacist's name on the prescription label? Let's ask Ms. Carpio over here, Sarah Carpio. When would you find the dispensing pharmacist's name on the prescription label? I just told you.
The initials would be on
Not the initials, the name.
the name, be in the bottom right corner.
Not usually. Give one more person a shot at it. Mindy Chen, when would you find the dispensing pharmacist's name on the prescription label?
When the pharmacist feels that,
When the pharmacist what?
wait, could you repeat the question?
When would you find the dispensing pharmacist's name on the prescription label?
When there's need, if the patient has any questions to call a pharmacist for further instructions.
That would be on the prescription label? The pharmacist's name? You would have the pharmacist's name when they're the one that wrote the prescription, right? Right? Did we just say whoever was that wrote the prescription? So we'll go over that in a little bit. But if the pharmacist is the one that wrote the prescription, is their name that goes up for the prescriber or furnisher, right? Okay. How about a physical description of the oral dosage form, such as a white oblong tablet, a blue round tablet? Is that required on the prescription label? It is in California. When that bill was first passed in the legislature, the requirement as it was initially proposed was a requirement for there to be a digital image of the dosage form. So instead of a description, they'd have the blue tablet or the red capsule. And that made it through, I think, the first hearing in the subcommittee. Then we found out that there was only one company, so one software company, that had the ability to do that. And the state legislature says, we're not in the business of establishing monopolies. We want free competition. So they changed that requirement to a physical description as opposed to a digital image. Okay. And the same requirement is regardless of whether the prescription comes from a pharmacist or being dispensed by the prescriber. The prescriber may dispense, but the labeling requirements for said prescription are the same as if it came from a pharmacy, with the exception that if it comes from a prescriber, it does not need a prescription number. If it comes from a pharmacy, a prescription number is required. It is not required if it comes directly from a prescriber. But all of the other requirements stand true. Okay. Okay. How about, you're going to have to help me out here because I went through everybody on my list. So where is Derek Dorsey? There. Okay. So where's home for you?
Modesto.
Modesto. Okay. As I recall, with Modesto, there is a fairly large Hispanic community. Yeah?
Sure.
Okay. So, what if you're working in a pharmacy in Modesto and a patient comes in and they don't speak English, they only speak Spanish? Are you required to label your prescription label in Spanish?
No?
Yes. Yes. Spanish is second to English in terms of the prominence in the state of California. Okay. So it is required in the state of California that if it's evident to you that it is not a native English speaker, and if they would prefer one of 8 languages, I believe, then you print the directions in their native language. And those languages are listed on the Board of Pharmacy website, but they include, obviously, English, Spanish, Russian, Chinese, Tagalog. I'm trying to remember what else. I'm sorry? Those are the ones that I recall off the top of my head. And you're saying Russian, but there's a very large Russian population in California. Yes.
Is it similar to the elections offered on the election ballot? You see different languages.
Is very similar, and what the Board of Pharmacy has done is they've taken the common directions that you would normally find on a prescription container and had them translated, and it's been vetted. They went through several hearings to make sure that the translations are accurate. Okay, so basically you just go to the board website, you cut and then paste onto the label. Okay, and it doesn't have to be necessarily affixed to the label. It could be a separate sheet that's given to the patient. Okay, but the intent is to provide the best service, the best safety for the patient, so the patient understands how to take their medication. Jenny Ear, where are you? Jenny, okay, so since we're talking about translation of services, okay, we talked earlier about providing consultation, right? So, the same patient The same patient comes to you, and they don't speak English. They speak Spanish. Do you speak Spanish? No. Why not? You live in California. I went to Vietnam. I spoke French. Anyway, so what if the patient needs consultation? Are you required to provide consultation in Spanish? I'm sorry?
So at the pharmacy, they would have like a helpline,
A helpline.
like a language translation service line, where you can, ask them to translate for the patient.
Okay. Typically, that's the AT&T language line. Okay. That's the one that's most frequently used. That's the one that's recommended by the board. Okay. Now, what if the person says, oh, I have a family member here. They could translate. Is that preferable?
So if there's a family member that can translate.
Yes. Is that preferable?
If there's no other options.
Well, you always have the other option. It's required by law.
Yeah.
The question is it preferable? What if the family wants the family member to translate? You guessed wrong. You should never use a family member to translate unless you have no other alternative. Okay? For example, if it's a language that on the AT&T language line they can't figure out what it is. Okay? And the reason for that is that family members are biased. Okay. And sometimes they censor things. Okay. I mean, you can let me give you an example. Okay. So you're dispensing oral contraceptives, and the patient's mother is there translating. So you're explaining all this thing, and the mother is translating for the daughter, and you go through all this about, the precautions, and then the mother says, the doctor said you shouldn't have sex. You don't know what they're translating. They censor a lot of stuff. Okay. I've seen this over the years where I go through and explain this thing, and it takes me about 5 minutes, and then they turn to the other person, they say 3 words. There's no way they could convey everything that I just said in 3 words. Okay. That's why you shouldn't use a family member to translate, unless that is the only option. Maybe phone lines are down, you can't get a hold of any of these, so something like that.
Something I wanted to add about a translator.
Okay.
Anytime you use a translator, always talk in the first person, as if you're talking to the patient, and then use shorter sentences, 1 or 2 sentences, so that the interpreter has time to and doesn't leave out information when you're interpreting to the patient.
Okay, that's very good.
Okay.
Yes.
What if the translator is also a health provider as well? So he has the same level of medical literacy. Right?
Yeah.
So, but does that still?
I'm sorry, what if the
The translator, the family member, is also a medical provider? So
does that mean they're unbiased? Does that mean they won't filter things? No. Wait till you have kids. You learn how to filter things. Especially daughters, I tell you. Okay. Lala Hajosani? Where are you? No, not prepared. Okay. Jeff Shao. Where are you? Okay. So we give you an easy one, okay? She says, oh no. Is it permissible to give false or misleading information or to intentionally mislabel a prescription?
Well, that would be a bad thing to do.
You didn't answer the question. It's a yes or no question. First of all, is it lawful to intentionally mislabel a prescription? Intentionally mislabel a prescription. Except? The answer is yes, except when it's lawful. The law is like that. It says, the pharmacist shall not mislabel or provide misleading information on a prescription. Unless, then it gives you two examples when it's permissible. Okay? So one area, okay, question, yeah. Go ahead.
Oh, I'm just gonna answer.
Go ahead.
If it's a study and it's using placebo.
Very good. If it's a study, a research, something like that, right? Anything else?
When the prescriber thinks that it's in the best interest of the patient.
Very good. Shoot, I'm having trouble. I feel a story coming on. Okay. Back when I just finished my first year in pharmacy school, I was a hotshot intern. Didn't know squat, didn't know what I was doing, but I got a job as a intern pharmacist at Fletcher's Pharmacy on J Street in Sacramento. Right across the street from Sutter's Fort. Old-time pharmacy. It's been there since the 1860s. And back then, there was a new drug out called Librium. It's one of the first benzodiazepines. It's a tranquilizer. And, you know, there are a lot of seniors, a lot of elderly people that went to that pharmacy, and this lady would come in. She was one of the regular customers, and she said she was there to pick up her prescription, her refill for the Librium. Okay. She says, "Don't you think my hair looks nice?" You know, she's like, you know, late 60s. "Yeah, lady, your hair looks real nice." And he says, "Yeah, you know, it's been a lot fuller since I started taking the Librium. And it keeps my hair from, it really did a good job of keeping my hair from falling out." I said, "Librium's a tranquilizer." So I looked at her, and then I figured out she was serious. And he says, "Librium doesn't keep the hair from falling out." She goes, "Well, that's what my doctor told me." So, shit. So my preceptor, old man Fletcher, comes back. "Well, you know, this is one of those drugs that's got a lot of different uses." What this lady was doing, she was suffering from anxiety. And the girls know, you know, when you get nervous, you have this habit, you twirl your hair around your finger and pull. She was literally pulling all her hair out because of that nervous habit. So the doc put her on the Librium. She stopped having so much anxiety. She stopped pulling her hair out, which allowed it to grow out. That's why it was fuller. Okay. But we had to go along with that. Okay. So the requirement, if the prescriber wants you to intentionally mislabel something, is that he has to inform you how he wants it labeled, and he has to document it in the medical chart, in the outpatient chart, that he had instructed you to intentionally mislabel the prescription. Okay. Doesn't come up very often, but once in a while you'll run across something like that. Okay. Also, while I'm on the subject, yes, question.
I just was wondering, does the prescriber, do they have to put that on the prescription or just in the patient's chart at the office?
Just in the patient's chart, because if the patient carries the prescription, they're going to see, please mislabel prescription. Kind of destroys the purpose. In most cases, it's telephoned in, you know, and all you got to do is okay, you've just verified that they've documented in the patient's chart that you're instructing me to label it like this. And they say, yeah, I wrote down it. That's all that's required. Okay. There's no requirement that you get a copy of what the chart says or anything like that. You just have to, you probably want to, in the notes, that you verified with the prescriber that they documented those instructions in the patient's chart. Okay. What else? Okay. 4077. Let me take a look exactly what the. Oh. This seems obvious, but they made this law for a reason. Whenever you're dispensing a refill, you're required to give them a new container. You can't just throw it in the old container and give it to them. You can't even throw it in the old container and put a new label on it. You're required to give them a new plastic container. Spend the 3 cents. Because there are some places that would just reuse the container till it was like 10 years old or something like that. Okay. Let's talk about scope of practice. Who may, let's see, Anna-san, where are you? Who, okay, so we talked about who may prescribe, who may dispense? I'm sorry?
Anybody that works in a pharmacy that has a license to do so, whether it's a technician or a pharmacist or an intern pharmacist.
Is that right? The technician may dispense? Not in the legal term. Technician may not dispense. How about a prescriber? May a prescriber dispense? Yes. Does the prescriber have to be working in a pharmacy? No. Okay. Dispensing means everything, including ultimately the final check. Technician cannot make the final check. The technician may not counsel the patient, which is part of the dispensing process. The technician may not evaluate whether or not drug interactions or side effects are present, or whether or not they're serious enough to discuss with the patient. The technician can't do that. May the intern do that. May the intern perform the final check on a prescription. Is it some people saying yes, some people say no? What does it say under the law? Under the law, it says an intern pharmacist may perform all the duties of the pharmacist under their direct and immediate supervision. All. Okay. That includes performing the final check. Now, you, as a P1, you think the pharmacist is going to trust you to do the final check? No. For those people that just graduated in the class of 2016 and they're waiting, they already took the board exam, they're waiting for the results of the license, you think they might let those graduates do the final check? Probably so. Probably so. Might be a few exceptions here and there, but for the most part, okay. Tanya Sandu, where are you? Tanya. Okay, so we talked about some of the expanded scope of pharmacy practice, where the pharmacist may write prescriptions. Okay. So, in what venues, in what environments might a pharmacist write a prescription? And what are the requirements? Can you hear her? They can't hear you.
In a pharmacy.
In a pharmacy. Any pharmacist can write a prescription in a pharmacy. Is that what you're saying? Vivian. Okay, there's four general areas. Okay, one, in a licensed healthcare facility. Okay, what is a licensed healthcare facility, Ms. Dow? Give me two examples.
For example, like if you're at Sutter.
An acute care hospital, right? And what's the other example of licensed healthcare facility that you've learned about last block? Mr. Calloway.
Skilled nursing facility.
Skilled nursing facility. Very good. Okay. So there, pharmacists may write prescriptions pursuant to protocol. There is no other requirement other than they be employed as a pharmacist there or contracted to provide services in that environment. In what other environment may the pharmacist write prescriptions? Jimmy Huang, where are you? Where's Jimmy? Okay. In what other environment other than licensed healthcare facility?
Ambulatory care.
Ambulatory care, which is defined as outpatient? Is that it? So CVS is ambulatory care?
No.
That's outpatient though, right? So what's the other venue? A clinic? Okay, what else is included in that category under the law? A clinic? I'm sorry, I can't hear you.
Emergency room.
That's an acute care hospital, isn't it?
Yes.
Does that fall into the last category?
Yes, it does.
Okay, so a clinic.
Skilled nursing facility.
What?
The clinic is skilled nursing facility, right?
No, skilled nursing facility is a licensed healthcare facility.
Oh, can you repeat the question again?
Okay. In what other venue other than a licensed healthcare facility? Well, basically, you started it by saying clinic. So what else is covered under that category of clinic?
Is it a long-term acute care facility?
Well, that's a licensed healthcare facility, right? So what else other than, what falls into that category with clinics? You could look it up if you like. 4053.2. Let's see. Michelle Huang. Help them out. What else falls in that category besides clinics?
You told us to look it up, so I'm looking it up right now.
Should I give you a hint?
Yes.
Where does Dr. Ip work?
Oh. The type of
In conjunction with the care provided by a health plan. Right? Which health plan would that be? Kaiser. Right? Where did I spend 17 years of my life? Kaiser. Okay. That's one of those things that when that law was passed, we wanted to make sure that our people were covered. Okay. Actually, our people were doing that before the law was passed. They passed a law to make what our people were doing legal. It wasn't illegal, but it wasn't specifically legal either. So when they drafted this law back in 1986, they put in language, so in conjunction with the care provided by a health plan. So that way, our pharmacists could adjust prescription doses in the pharmacy, so long as the pharmacy was associated with the health plan. Okay. Or with the care provided by a physician. Okay. So it was fairly broad. Ms. Kaur, Manpreet Kaur, where are you? Okay, so what are the requirements for pharmacists under these venues to be able to write prescriptions to furnish if they're in a clinic or associated with the care provided by a health plan or under the supervision of a physician? What are the qualifications required of the pharmacist? What does the pharmacist have to have? Okay, you have to have a residency or direct patient care experience. Okay. So, not everybody had that experience. You know, not everybody was able to complete a residency, but if you've been working under protocol in a hospital and you had that experience providing direct patient care, then they grandfathered you in. Also, if you had direct patient care, say you got your training in the military. Those of you that were present yesterday when the Navy was giving their pitch. That's the beautiful thing about the military is they're exempt from all state laws. So for 90 days at sea, I was practicing medicine. And it was completely legal because it was international law. And that counted. Or technically, if you served as a corpsman, you know, not even an officer, an enlisted personnel, but you were a medic or a corpsman, that counts as direct patient care. So you would be able to apply that. Okay, so let's look at the third category. Okay, Patrina Kim, where are you? Okay, so Patrina, when we're talking about, somebody else had said that any pharmacist in a pharmacy. Okay, is that, how can we make that true? How can a pharmacist in a pharmacy write prescriptions? For anything? Then what? What can they write prescriptions for? Okay. So they can write for IUDs? I'm sorry?
I would say because it's a device, usually you can't give
You could dispense it. You could dispense it in a retail. Yeah. What is the specific verbiage of the law when you talk about contraceptives? Self-administered. One more word. Hormonal. Self-administered hormonal contraception. Okay. And can just any pharmacist in a retail pharmacy do it? No. What do they have to go through? No. No. Okay. Ms. Baker, is it? No. Nope. Let's see. Eric Lai. Where's Eric Lai? Yeah, he's hand like that. So what's required of the pharmacist in the retail pharmacy in order to dispense self-administered hormonal contraception? There are two ways that they can meet the requirements. Give me one of them. Huh? What sort of training? What's specifically required by law? See, it's this level of detail that they're going to ask you on the board exam. Okay, so you have to be able to recite this stuff. What is the specific requirement? Adam Lynn, can you help him out? Where's Adam Lynn? Right there. Front and center.
Did they have to be advanced practicing?
Nope.
They don't?
No such requirement. Wait a minute. Are you sitting in the right seat? Oh, I see. So, Mr. Vallarta, right? Okay. Oh, I called on you the first day. Okay. What's the qualification?
You have to follow the protocols from the Medical Board of California.
Okay, well, besides doing that, what qualifies the individual? Right next to you, Mr. Seiku? Seiku. What are the requirements?
Well, they graduated from a pharmacy program that do that.
You mean like this one?
Yes.
You have to learn it in pharmacy school. Okay. Or what else? What's another way if they didn't have it in pharmacy school?
They would do the continuing education that provided that knowledge.
For how long? For how many? How many hours?
I do
Take a wild guess.
72 hours.
How about one? 1 hour of continuing education. Okay. And you have to follow the protocol that's been jointly developed by the Board of Pharmacy and the Medical Board. When I say jointly developed, I use that term rather loosely. It was developed by the Board of Pharmacy, and then they sent it to the Medical Board, and the Medical Board says, yeah, that's fine. I mean, that's the state's definition of jointly developed. I saw some hand, Mr. Cook.
The wording says specifically on emergency.
No, that's a different section.
Okay, I'm reading someone else.
Yeah.
Sorry.
Emergency contraception is different, okay? So self-administered hormonal contraception is so that you won't get pregnant, okay? So emergency contraception you already had sex, and you're afraid that you might be pregnant. Well, not you personally, but you might be pregnant. So what you want to do is you want to make sure that the egg doesn't implant. Okay. So that's a little bit different. Okay. So when you're dispensing this self-administered hormonal contraception, what different forms can it take? Jevons Louis, where are you? Okay. What different forms can it take? What's self-administered hormonal contraception? Birth control pills, yeah. Patch? NuvaRing. One more. No, it can't be IUD. IUD is not self-administered. The injection. Okay. Progesterone injection. That's hormonal, it's self-administered. You can teach somebody to give themselves an IM injection. Okay. Those are the different modalities. So if you dispense one of these, how would you label it? Whose name would go under prescriber? Veronica Madrigal. Where are you?
Here.
Whose name would go under prescriber?
The pharmacist that prescribed it.
Could pharmacists prescribe?
And say if the pharmacist prescribes it.
No.
What is the question?
Whose name would go under the where it says doctor? Pharmacists can't prescribe. We just went over that the last hour.
Who furnished it?
Pharmacists who furnished it. Okay. It's a term of art. Okay. So you have to really become familiar with that. And this is unique to California. Okay. But the California Medical Association, they're very protective of the word prescribe. That's why every year the clinical psychologists, they want prescriptive authority, and every year the California Medical Association shoots them down. Won't let them do it. Now, when SB 493 passed in 2013, there were two other companion bills introduced by Senator Hernandez, and another one introduced by Assemblyman Emery, I think it was. So there was a bill to expand the scope of pharmacists, nurse practitioners, physician assistants, and optometrists. So of those four bills, how many of them you think passed? One. Only one. Only the pharmacist bill passed. And it took a lot of amendments, and it took a lot of negotiation. But do you know why only the pharmacist bill passed, not any of the other ones? Go ahead.
Because there was no diagnosis.
No diagnosis required. Very good. Let me see. You're Jimmy Lee. Very good. Everything that expanded the scope of authority. Okay. You don't need to diagnose whether a woman doesn't want to get pregnant. I mean, she knows she doesn't want to get pregnant. You don't need to diagnose anything to know if someone's going to be traveling internationally. They know that they're going to be traveling internationally, okay? He says, well, what if they have symptoms? Believe me, when a person's overseas and they have diarrhea, they'll know they have diarrhea. You got all this stuff coming out of their butt. Gee, I wonder what that is. They know they have diarrhea. Okay. You don't have to have a diagnosis to know that someone needs immunization, because the schedule is listed on a CDC website. as recommended for certain people in certain age groups. Okay? You don't need a diagnosis in order to order lab tests. And the lab tests are specifically for the monitoring of the effectiveness or for toxicity of drug treatment. So it's narrowly tailored. Okay? It's not just any test, and it's not just laboratory tests. It just says tests. So if you have someone on a drug that's ototoxic, basically damages the ears, you could order a hearing test. Let's take a break and come back at 10 after. Okay.
So what if, when we're taking work people from other places,
State your question. I'm not sure.
So it's kind of hard because people, when you struggle with different hormones.
Okay. So bottom line, what's the question?
So you're only allowed to dispense with specifically
For contraception.
So if you're using it
Then that's not for contraception.
So would you refer like if I'm like I reacted to this, it's not working for me, because they struggle with different hormonal levels.
Okay, so if it's still in the area of contraception, you can try a different contraceptive. Yeah. I mean, that's what the OBGYNs do. Yeah. That's under the protocol. In fact, like that on a board exam.
I just think about those things just like real life situations.
Yeah. They'll ask, person has requires high levels of estrogen. Which contraceptive would you start the patient on?
Oh, okay. So we need to know like all the different, because there's so many different things.
But there are only 4 general types, and they all follow. Yeah.
So you would need to know which one, if they use higher estrogen.
Or the cyclic, or You're going to learn a lot in the next 4 years. You'll be amazed. Mark my words. Next year, when you're P2, look back at everything you learned over this year. You'll be amazed. Yeah, it will. And that's why our program is so rigorous. You're learning everything that everybody else learns in 3 years, in 2 years. Yeah, it's a lot of stuff. Yeah. You friends that were friends at school? No. I mean that's okay. Yeah. So. You can see him over like Christmas break or something.
I might like her. She lives in the area.
Okay. If you see her during Christmas break, or even over the summer, ask her what drugs they are. You guys learning about drugs, right? Babies. UCSF didn't know anything about drugs in the first year. Which means they learn everything in a second. Imagine everything you have to know is that you have to learn in 1 year and a half. Well, this is we started this program because we figured that, you know, one thing that advance training is basically employers they want pharmacists that are practice ready. I've been a manager for 40 years. And it's frustrating because I hire a new grad and I got to spend his first 6 months teaching him how to be a pharmacist. What'd you do the last 40 years? You know? Yeah. Or usually 1.5. Yeah. But you know, one of our alums is faculty now at UCSM, and when she did her residency there, you know, it's always two amateur rotations. No, I already. No, I could do that. Undergrad when I was so they had to be one advanced amateur rotation. Pick what you want to do. Yeah, so she had to do critical care now. She's critical care pharmacist at UCSF. Not bad for a model. I'm sorry? Well, that's why Kaiser, 2/3 of the residents I mean, I worked for 17 years. That's the place to work. The only reason I quit is I didn't get along with my boss. And that and I hit a glass ceiling because I was area manager. And the next promotion was vice president. And he was only 5 years older than me. And then I was 39 years old. So assuming people retire at 65, and then the next 25 years with no promotion. Yeah, so I decided I was going to switch careers. And I decided to become a lawyer. We have a very close relationship with Kaiser. Kaiser trains about 1/3 of our students. They hire about 1/3 of our students. Okay. Shall we resume? Let's get started again. Hong Nguyen. Where's Hong Nguyen? Right there. Okay. So we talked about self-administered hormonal contraception. What else are some of the expanded authorities granted pharmacists? What else can you do under 4052? Business Professions 4052. Okay, you could furnish self-administered hormonal contraceptives. What else? Travel medication. Okay. That one requires a little bit more training than 1 hour. That one I think is it 20 hours? Or what? Or if you had it in pharmacy school, right? Isn't that what it says? Nod your head, yes. Yes. So you have to have the 20 hours of training for travel meds plus the CDC yellow fever training. Or you could have the training when you went to pharmacy school, which we do here. Okay. And I think that's, in fact, I don't just think, I know that that's Dr. Emily Chan because I gave her the requirements of what she needed to teach. Tatiana, I haven't called on you. Your sister would be disappointed if I didn't call on you. So, what else? What else is one of the authorities, expanded authorities granted to pharmacists? We already talked about self-administered hormonal contraception. We talked about ordering lab tests. We talked about, what did you say? Travel meds. Okay, so what else? I'm sorry? The last one we talked about was travel meds. Immunizations. Okay. So, what immunizations can pharmacists give? Any immunization? Yes, any. Any immunization recommended by the CDC, right, on their schedule. Mr. Is it Senate or Sino? Senate? Yeah. Okay. So what other authorizations? What other authorities? We talked about travel meds. We talked about self-administered hormonal contraception, immunizations.
I thought that's all. Smoking replacement therapy.
Nicotine replacement therapy. Gee, how did you come up with that? Okay. So, originally the verbiage was smoking cessation therapy, but then that included a lot of other things like clonidine or some of the psychotropics that are used, and they didn't want to expand that much. So we limited it to nicotine-based or nicotine replacement therapy for smoking cessation. Okay. Now most of those are OTC anyway. There's one that's not. The nasal spray, I believe, is prescription only. So you can furnish that. Okay. And of course, ordering laboratory tests and making referrals. This is big. Okay. You refer somebody to a specialist. You have to be able to do that. And right now, Medi-Cal is sending out advisories in order to make a referral. you have to be registered with Medi-Cal in order for them to accept the referral. Okay. And you have to be registered with Medi-Cal if you want your prescriptions that you write to be paid for by Medi-Cal. Okay. Let's see, who are we going to call on next? Hung Tran? Where's Hung Tran? Right there. Okay. So, let's say, have you ever worked in a pharmacy?
Maybe, yes.
You have? What do you mean maybe? You're not sure?
I don't know, you scared me.
Huh? You worked in a pharmacy before,
Yeah.
retail pharmacy, right? Okay. So let's say, is the pharmacy open on evenings?
Yes,
Yes. Okay. Weekends too?
only on Saturday.
Only on Saturday. Okay. Okay, let's say it's Friday night. 7 o'clock. Okay. And the patient comes in. You dispensed nitroglycerin before? The small little tablets?
Yes.
Glass bottle? People, when they have chest pain, so they take the nitroglycerin so they don't have a heart attack, right? So patient says, can I get one of these? Can I get this refilled real quick? This is the nitroglycerin I have is outdated. And you look in the prescription files and says, you don't have any refills. But I'm starting to have chest pain. What do you do?
Oh, that's the question?
That's the question, yes.
You use your best judgment, and if you can't contact the doctor for refill, then you can give a supply. I don't think you can give like partial fills. Doesn't have to.
That's why I asked about nitroglycerin. Nitroglycerin is one of those drugs that requires that you dispense it in the original container unopened. Because nitroglycerin is volatile, okay? That's why it comes in a glass container with a metal cap, okay? If it was in plastic, the nitroglycerin would evaporate through the walls of the plastic. If it's opened, the minute you open it, it starts evaporating into the air. You have to dispense in the original container, unopened. So you can't give a partial. And what he said is exactly right. If your patient doesn't have any refills remaining, and you're unable to get a hold of the provider, and you think that the patient will suffer if they do not receive the medication, you are authorized by law to give a reasonable amount until you can notify the prescriber that you did so. In this case, a reasonable amount would be the entire bottle, because you can't dispense a partial of nitroglycerin. Thank you very much. Crystal Trang, where are you? Okay. Same scenario, only it's not nitroglycerin. It's prescription strength loperamide, which is for diarrhea. Okay. It contains a narcotic. Does that change things? Yeah. Are you still able to give them a narcotic even though they have no refills? I'm sorry?
No.
And where are you getting this information from?
Yes, unless it's in Schedule 2.
And where are you getting this information from? From your neighbor. She just whispered it to you. You think I didn't see that? That's correct. If you feel that the patient may suffer as a result of not receiving the medication, you may give a reasonable amount until you can get a hold of the prescriber, unless it's a Schedule II controlled substance. We'll go into that next semester, but by definition, you can't refill that because there are no refills on a Schedule II controlled substance. Let's see. Did I hit everybody on this one? Rachel Peng. Where's Rachel Peng? I didn't call on you. Okay. So, is it ever permissible to dispense a prescription medication to a patient when they have no prescription? Under what circumstances? And it just happened this past month. I'm sorry? When there's a declared emergency, okay, such as earthquake. What happened last month? Just north of us. No, LA is not north of us. Lake County. We have some of our alumni that live up in Lake County. They were worried because the fire it got to like within 500 feet of their house. The fire in Lake County burned several hundred acres. Destroyed one entire town. So, the Governor Brown, declared state of emergency, and responding was the state board says that they are authorizing the emergency services, which means that a pharmacist in the area may dispense prescription drugs based on the patient's claim. As long as it's reasonable, as long as they attempt to get a hold of the prescriber, okay? What are the other requirements? They can't hear you. I can barely hear you here.
Cannot dispense a new prescription?
You can. That's what you're doing. You're dispensing a new prescription. No, it includes controlled substances. You need the patient's name, right? And their address. And you need to notify the attending physician or the prescriber. Okay. Why? So that they'll know that you dispense this drug to their patient. Okay. What if the patient's home was burned down during a fire? You still need to get their address?
Yes.
Why?
The post office will send it to
I'm sorry?
the post office will send it to the new address.
Well, that's not why. The reason you need to get it is because it's required by law. And you have to notify the prescriber. What if the prescriber's office was burned down in a fire? You still need to notify the prescriber? Why? Because it's required by law. Where'd you come up with that? That's very good. Okay. And they have such a thing as a mobile pharmacy. Okay. This, I don't know if you guys are too young to remember. Remember when the hurricane hit Louisiana some years ago, and the feds were really sharply criticized because it took them 10 days to send relief, you know. And they had all these people in shelters, makeshift shelters. They had people, basically the Superdome in Louisiana where they have the Super Bowl a lot of times, that became a massive hospital. They had to use that as a hospital. And they had people there that were able to write prescriptions, but all the pharmacies were destroyed, so there's no place for the patients to get prescriptions filled. So in response to that, the state of California authorized mobile pharmacies for only such an occasion. So basically you get, it's like a taco truck, okay? Taco truck that can be secured, and you stock pharmaceuticals in there, and you drive to the emergency, okay? And you function as a pharmacy. You have all the same requirements, labeling and all that. And you have to shut down operations, I can't remember how long, within a reasonable period after the emergency has ended, okay? And the reason they give you some time after that, because afterward, you know, once they get to another pharmacy, that pharmacy is going to want copies of your prescription records. It has to be somebody there to be able to give it to them. Okay. Does anyone know what the number one business in California is? It's not pharmacy. Anyone know? Entertainment. Entertainment. What do you expect? Yeah, but you live in the same town as Six Flags. Okay? You live in the same state as Disneyland. Entertainment. What's number two business? Not even close. Come on, you got to know. So agriculture. California grows 80% of the vegetables, fruits and vegetables for the rest of the country. Okay. What's number three? Trade and shipping. Okay. You look at the California coastline. California's got a lot of coastline, okay? So, since we're talking about shipping and stuff, when can you sell prescription drugs in a non-emergency situation to a non-healthcare professional? Mr. Cook. I'm sorry? No, they're licensed. There you go. An ocean-going vessel. Or as they say in Star Trek, vessel. Okay. So the reason they do that is that people that are on the ship, they have medical problems too. Okay? People have high blood pressure. People have diabetes. Sometimes people get injured on a ship. Trouble is, when you're out in the middle of the Pacific Ocean, it's difficult to go to the nearest CVS. What are you going to do? Therefore, the California legislature, in its infinite wisdom, and wanting to maintain that positive relationship with shipping, has authorized ocean-going vessels to procure prescription drugs. So, let's see. Who haven't I called on yet? Oh, IVU. Where's IVU? Okay, so what are the requirements? What do they need from an ocean-going vessel?
The prescription has to be on the ship's letterhead.
Has to be on the letterhead. And requisition has to be from who? or the captain. They call him the master of the vessel. Okay. And suppose you had a request for 28 amoxicillin. Okay. Can you sell them 28 amoxicillin? Why? Sealed container, unopened. You can't, I've never seen bottles of 32 or 28 or any odd number. You have to sell them a full container, okay? Usually it's a quantity of 100. Can you sell them controlled substances? She's thinking. Provided, you sell them controlled substances, provided they have authorization and a DEA registration from the medical officer. Now you have to understand that on these ocean-going vessels, the medical officer is not the person that's on the ship. The medical officer is someone that they contract with to take care of the fleet. He's probably got an office somewhere in Seattle, okay? But usually that medical officer is overseeing like a dozen different ships and says these are the standard supplies that you should have if you're crossing the Pacific Ocean, okay? And occasionally people get injured while they're crossing the ocean. And no, the ambulance can't come and get you if you're in the middle of the Pacific Ocean. They can airlift you, however. And if it's scheduled, we'll get into Schedule 2s and stuff next semester. Okay.
Regarding the ocean-going vessel, does it require like a medical provider to be on to administer these
No.
medications? No, so it can be anybody?
Yes.
Oh, okay. And everybody has access to them then?
No, the first officer or the master of the vessel.
Oh, so they're only to have access to
Yeah.
on the vessel.
Yes. They're the managers. Yes.
Question. Do they define vessel? Like what size, as long as it's licensed?
Let me ask you. Okay. Suppose. Okay. Where are you from? Where's home for you? It depends. He's homeless. Okay. Are you familiar with Lake Tahoe?
Not that much.
Not that much. That's why he still has money. He doesn't go gambling. Okay. Lake Tahoe is this very large lake in Northern California. It's about 150 miles, 200 miles east of here. Okay. And it's got a big lake, and they have ferries that go back and forth. Okay. So can that captain or the first officer of one of those ferries come to your pharmacy in Truckee, California, submit to you a requisition for medical supplies on the ship's letterhead, and obtain them?
I'd say negative.
Why?
It's not an ocean-going vessel.
Not an ocean-going vessel. Okay. How about the ferry that goes back and forth from Vallejo to San Francisco?
It has to cross like a large body of water.
Doesn't have to cross. Has to go out into the ocean. The ferries only stay on this side of the Golden Gate Bridge. Okay, now, you ever been on a cruise? Deprived. One of these days, take a cheap cruise. Take JetBlue down to Long Beach, and take the 3 or 4 day cruise from Long Beach to Mexico. Okay, it's cheap. It's only $300 something. You know, it's like $100 a day. Yeah, use your student loans. Everybody else does. So anyway, what they do, okay, it's a 3-day cruise that goes from Long Beach to, is it Ensenada, I think it is? Yeah. If you really wanted to go from Long Beach to Ensenada, it'd probably take half a day. So why is it a 3-day cruise? You know what they do? They go out beyond the 30 miles and they just go in circles. You know why? Because once it's outside of the 30 miles, you can gamble. They had to open a casino. International law. And you're on the open ocean. So even though you only go 30 miles out, that's in the Pacific Ocean. So that counts as an ocean-going vessel. Okay. An ocean-going vessel actually has to go on the ocean. It doesn't have to cross the ocean. It just has to go into the ocean. Okay.
Is it technically like international waters? Is that what
It is, yes. That's why they can have gambling. You like gambling? What kind of Asian are you? I tell you, any of my relatives come over, man. Even my friends from Hawaii, first thing they do, let's go to Las Vegas, Mahjong. Oh, my wife would love that. Okay. Let's see, who we got? Cynthia Yee, where are you? Okay. Can an emergency room dispense prescription drugs to directly to a patient? Under what circumstances? What if there's a pharmacy inside the hospital? I'm sorry? Okay, and if they're not open, then what? Not yet. There has to be no other pharmacy open in that area. Okay. Now, usually they'll consider like a 20 or 30 mile radius. 20 or 30 miles is reasonable if you get a prescription to go to that place and get your prescription filled. Okay. But if the pharmacy is open, even if they don't fill prescriptions there, then they can't do it. Okay. Gee, we still got a lot of stuff. I'm gonna defer some of the stuff till our next class. When is that? Is that next week? When do we go over California Code of Regulations? Okay, so some of the stuff I'm gonna defer till next time because I'm not gonna have a chance to go over everything in the next 20 minutes. Where's Bailey Yuan? Okay, so if you have a change of PIC, how long do you have to notify the Board of Pharmacy? I'm sorry? You have a choice?
30 days.
30 days. Okay. If you sell the pharmacy, change of ownership, how long do you have to notify the Board of Pharmacy? 30 days. If you have an unexplained loss or a theft of narcotics, how long do you have to notify the board? 30 days. That's pretty good. How do you know all this stuff? If you're filing for bankruptcy and you have to transfer the drugs pursuant to receivership as a result of your bankruptcy, how soon do you need to notify the board? Immediately. I didn't catch you on that one. That's the one exception. Okay. Did we talk this?
By notifying the board, does that mean just send a mail out? Or do you have to, like,
Notify them in writing, and you keep a copy of that letter to prove that you did it. Okay. Consultation. Oh, we should talk about ratios. I understand this class is real good with math, right? No? Okay. So, over here, Caleb U, right? Did you get your intern license? Yeah, okay. So how many intern pharmacists can one pharmacist supervise?
Each pharmacist can supervise 2.
Two. Okay. Bobby Wu. Where's Bobby Wu? Huh? Okay, Bobby. How many technicians may be supervised by pharmacists?
You take the number of pharmacists, multiply by 2, and multiply by 1.
Oh, you must have talked to one of the P2s. Okay. So one technician for the first pharmacist and 2 technicians for every additional pharmacist thereafter. So the quick way to do it is number of pharmacists times 2 minus 1. That's correct. Okay. Actually, it depends. Okay. It depends. What does it depend on?
On their duties?
Exactly. Not their duties, but what they're actually doing. Okay. They have to be performing tasks that only a technician may perform. Okay. And the book goes and it gives you descriptions and says, what the heck does that mean? Is that what you said when you read that?
Yes.
Yeah. You're brave that you admitted that. Put you a minus, no. So, question.
Is that just so you don't overwhelm the pharmacist with prescription?
What is the Board of Pharmacy responsible for? What's the number one priority? Safety of the public. Okay. So if you have too many technicians that the pharmacist can't adequately supervise them, who does that jeopardize? The public. Danger to the public. That's why. Okay. But they have to be performing tasks that only a technician may perform. Okay. And they give you a description of the law, and I'm going to give you a shortcut, okay, to help you understand what that law says. That's why they pay me. So the technician's duties are those of handling medication and preparation for dispensing. Each word of that sentence or that phrase is important. Handling medication in preparation for dispensing. Okay? So let's give a scenario. There's one of the technicians that's working the front counter and they're getting prescriptions from the patient and getting all the information, their name and address and insurance information. Is that person performing technician work? No. When are they handling medication? They're not. A clerk could do this. Okay? So you don't count that technician in the mix. The next technician is calling the doctor's office for refills. Do we count that technician? That's a clerical task. They're not handling medication. Third technician, they're at the computer. They're typing in the information from the prescription into the computer database. Do we count this person? No, because they're not handling medication. Okay. Here's one. The shipment comes in from the wholesaler. They're unpacking the drugs and putting them on the shelf. Do we count this technician? No. I saw somebody going, oh. Yes, they're handling medication, but it has to meet all the criteria. If they're putting it on the shelf, is it in preparation for dispensing? No, it's the opposite. You don't count the technician that's putting stuff on the shelf. You count it when they start taking it off the shelf. They go pull it off the shelf and start counting it or measuring it. That is what a technician's duties are restricted to. Okay, that's when you start counting their hours. And unless they're doing that, they don't count in the tech ratio. Now, how about if you had one pharmacist and you had 3 interns? And one was ringing the cash register, and one was taking in prescriptions over the counter, and one was counseling patients. Is that legal? Anybody? No. Because there's no clause in the law that says, while the performing duties restricted to being an intern. Once you're an intern, you're an intern. The ratio applies no matter what you're doing. That thing where only if you're performing tech duties, that only applies to pharmacy technicians, not to interns. So say you got 2 pharmacists, you got 4 interns, you got 3 technicians. How many technician trainees may you have? 2, because you got 2 pharmacists. 1 technician trainee per pharmacist. How many clerks can you have? Unlimited, so long as the pharmacist may adequately supervise. Okay. Now, even if you're within the limits, if you are overwhelmed and cannot adequately supervise, then it is prohibited by law. Okay. You have to be able to watch to see what everybody else is doing and adequately supervise their activities. Now, what's the difference? Does the venue make any difference? Does it matter if they're in a retail pharmacy or a hospital pharmacy? Does it make any difference? What's the difference?
In the community setting, you need to have the pharmacist need to have line of sight.
Line of sight, direct supervision. You have to see what everybody else is doing. In a acute care setting, what's the difference?
You don't need that line of sight.
What's the requirement? Mr. Urbano, what's the requirement? Has to be on the premises. Okay. So the reason that the Board of Pharmacy encouraged that is so that the pharmacists in the hospital can get out of the pharmacy. Okay. You can't respond to a code if you're locked up in the pharmacy. You can't go up on the floor and see how the patient's doing if you're locked up in the pharmacy. So they wanted the pharmacists to get out of there. So if you look at it from the opposite end, the technician in the hospital has got a heck of a lot more responsibility than the technician in a community setting. Because the pharmacist is trusting him to be in the pharmacy alone. And to be disciplined enough so that if a nurse comes to get a medication and the pharmacist hasn't checked it, the tech has to say, no, I can't let it out yet. But the patient's dying. There's nothing I can do other than you grab the medication, you print out the order, bring it up to where the pharmacist is, have them check it, and then you can give it out. Okay. That's the difference. Section 4127. I'm not going to go into a lot of that in detail. It has to do with sterile drug products. You're going to have that extensively next semester when you have Dr. Lucinda Chan. She's the one that's teaching a course this weekend to pharmacists on sterile compounding. She's the expert in that area. Oh, okay. Who do we have here? Ernesto Vigil. Where are you? Okay. Why is it that a pharmacy can sell soft contact lenses but not hard contact lenses?
Because soft contact lenses are considered a drug.
Very good. Why?
They interact with the body.
They interact with the body. They absorb the body solutions. Very good. How'd you know that? Talk to a P2. Pretty much. I encourage you to do that. You know, if you have a P2 mentor, which I think all of you do, talk with them. They might even tell you questions that are going to be on the exam. 4128 has to deal with centralized hospital packaging. That's where hospitals under common ownership, that's the thing, it has to be under common ownership, may package medications so long as the packaging has a barcode identification that's going to be used at the bedside. I'll talk a lot about that next year when I talk about medication safety and quality assurance systems. And IVs for that matter. Oh, okay. I got about 6 minutes left. Miss Aclolo, I didn't call on you yet. I missed you. Okay. So, in the great state of California, okay, and we talked a little bit about this last block. If a patient brings in a prescription for blood pressure meds from the state of West Virginia, may the prescription be filled in your pharmacy in California? Yes. Okay. If the prescription is written by a doctor in Hong Kong and they bring the prescription to your pharmacy, can you fill it? Hong Kong. That's in China.
It's not a territory, right?
No, China's not a territory of the United States.
Hong Kong's not a territory. Not like Guam, it's not a territory.
No.
No, you cannot.
Okay. The law says that a pharmacist in California may fill a prescription written in any of the United States. And in another section of the law, it defines the United States as any of the states or its territories, which means includes Guam, Puerto Rico, American Samoa, and the U.S. Virgin Islands. Okay. Otherwise, President Obama couldn't be president because at the time he was born, Hawaii was not a state. Okay. We got about 5 minutes left. Questions? 5 minutes, I don't think is enough time to go over a new area. Oh, I know. Let me check. Do they have a section on sale of syringes? They had that in this section, right? Okay. Okay. So, in the state of California, Jacob Long. I'm sorry. Yeah, Jacob Long. Where are you? Right in front. Do needles and syringes, as a general rule, require prescription in California?
Yes.
Yes. Anybody else I didn't ask? Uyen Nguyen. Where's Uyen Nguyen? Okay. Are there any time when someone could buy prescription, buy needles and syringes without a prescription? And give me some examples of when they may.
Insulin injection for diabetes.
I'm sorry?
Insulin injection for diabetes?
Does it specifically say diabetes?
No.
What does it say? For the purposes of administering prescribed medication. Isn't that what it says? Okay. Have you heard of a Mr. Hewlett and a Mr. Packard from Palo Alto? You never heard of them? Where are you from? Where is home for you? Where? SoCal. Okay. In Southern California, you never heard of Hewlett Packard? You have a computer printer? You may want to look at your printer. It says HP. Anyway, when Mr. Hewlett and Mr. Packard were first starting their company in the garage in Palo Alto, they were playing around and they had to make their components using glue. Only the glue, when they tried it out of the tube, they got too big of a glob. So they needed syringes and needles to get just a little bit of glue to pinpoint. Okay. How do they get needles and syringes without a prescription? That constitutes an institutional use, an industrial use. They use it in manufacturing. Okay. That's one of the exceptions. How about if a junkie comes into your pharmacy and he says, I need some more needles and syringes to inject my heroin? Can you sell it to him then? Yes. Yes, you may sell needles and syringes to junkies so that they can inject their heroin so that they don't pass HIV and hepatitis to other people. That's the Clean Needle Act. It used to be limited to 30 syringes. Now there's no limit. Okay. Because they started that as a demonstration project, and in the places that they were able to give away the needles and syringes, it reduced the incidence of HIV and hepatitis. Because what they were doing, what do they always do? They share needles. Not such a good thing. So they figured out that it works. Okay. Any questions so far? No? All right. Have a good lunch. I'll see you next, Wednesday? Oh, for those of you that attended the presentation by the Navy, he forgot to leave a sign-in sheet, so please put your name down if you're interested.
So if someone goes go to the pharmacy, say, oh, I need some syringe, and then the pharmacy can ask them, oh, what is your purpose? They just said, oh, we just want to inject heroin. But what if they don't say it? So the pharmacist, I mean, just by the presentation of the patient appearance, they cannot give it to them. Is that right? You know, when you see some, oh, they can give it to them, so we don't need to ask them.
Well, you need to ask.
Oh, okay. Once they said heroin, we can give it to them.
Yeah.
Okay. Anywhere in California.
Well, yeah. Basically, it's for prevention of transmission of,
Makes sense, yeah.
disease. Yeah.
Thank you.
I mean, there's a lot of people that objected to the idea basically you're promoting IV drug use. People don't start using IV drugs because they can get needles and syringes.
Sure. Because you can buy my mom, she injects insulin. She always buys on Amazon. They don't even ask.
Yeah.
That's what I thought. If that's a law, it should be required for them too. But you can buy it online.
Yeah.
With no question.
Yeah. So, again,
Yeah.
what's the use?
Thank you.
Yeah.
The needle require prescription.
Yeah, okay, that's the general rule, and then you turn around and say, but you can sell it to anybody. As long as it's the sealed container. When I was with Kaiser, they had the sealed bottle.